Well, good morning. I'm speaking today from Treaty 6 territory. I acknowledge the Métis people who share a deep connection to this land. I'm joined here today by Rob Thorburn, who has been waiting 5.5 months for an MRI. Now, on October 20th of last year, Danielle Smith made one promise that she's actually kept, and she's frankly continuing to deliver on. She told Albertans that under her UCP government, the journey to fix our healthcare system would be bumpy and perilous. Well, healthcare in our province is perilously close to collapse because all Danielle Smith and her government have done about the chaos in our public healthcare is to make it worse by continuing to ignore urgent and immediate needs of Albertans. There are hundreds of thousands of Albertans without access to a family doctor, dozens of partial hospital closures across the province, crowded emergency rooms, and agonizing wait times to get vital diagnostic tests done. Healthcare workers are valiantly working through the chaos, doing the very best they can under unimaginable workloads and intense stress. But many have lost faith that things will get better. Some have left the province, retired early, or left the profession altogether. And indeed, others are telling me that they'll be watching the outcome of this next election to decide whether they might do the same. Indeed, just yesterday we learned that there are still 22 unfilled family medicine spots here in Alberta. Meanwhile, BC, Saskatchewan, and Manitoba have filled all of their family medicine spaces. The UCP began their term in office by attacking primary care in Alberta. They tore up doctors' contracts, cut their pay, bullied them online and in person, and forced them to take on mountains of new paperwork just as the pandemic slammed into Alberta. Now, Danielle Smith, she leans on conspiracy theories about health and medicine, and she continues to ignore the advice of Alberta healthcare workers, damaging the government's relationship with those workers even more. She's gone so far as to blame them for manufacturing staff shortages, and she's told cancer patients that the disease was within their control, and they could have stopped it from progressing to stage 4. And while Danielle Smith openly discusses dismantling healthcare, we will focus on fixing it. So to talk more about some of the challenges he is facing under the UCP and our current healthcare system, I'd like to invite Rob to the mic.
Thank you, David. I'm here today because, although I'm not a healthcare worker, I've had a lot of experience with our healthcare system, and I fear for its future. On November 9th, my specialist booked an MRI for me because my test results indicated that potentially I could have cancer. I received a letter informing me the MRI could be on April 15th, but when I went for the test, approximately 5.5 months later, they said my pacemaker would not stand up to the MRI, and I've now been rebooked at a different hospital for June the 2nd. So what was a long, stressful wait for 5.5 months, wondering if the cancer was developing and spreading, is now stretching into almost 7 agonizing months. I was on the cancellation list for the first 5.5 months, but I never did get a call. I have one kind of a cancer that's terminal already, and I'm managing it, but this is a potentially different kind of cancer that I'm looking at that nobody knows if I have it. Because I haven't been able to get into the MRI, I'm certainly having symptoms. The healthcare system has let me down, and what's frightening is that if I'm waiting this long, there are other folks like me in the same boat, or even worse. Previous to this wait, I needed to get an ultrasound regarding the first symptoms that I was having, and that test was going to be a 3-month wait. But fortunately for me, there was a cancellation, and I was able to get in much quicker. Because I have cancer and other medical issues, I have to go to Dynalife for blood tests, and the waits are excruciating, especially for long emergency walk-ins. Let's say, for example, your doctor wants your test quickly, so you have to go wait in line, meaning it could take hours to get the test done. Even if you do have an appointment, I found at times that you still have to wait a very long time to be seen. Also, I live in Spruce Grove, and my family doctor has moved to Sherwood Park. I can't find a doctor taking new patients here in Spruce Grove. So I have to drive 50 kilometers to Sherwood Park to see him. And maybe I'm only in his office for 5 minutes, perhaps to get some results of a test or an upgrade to my medication. I'm retired now. I spent 45 years in forest fire, wildland fire training and operations. I ended up being the director of the Forestry and Provincial Wildfire Training Center in Hinton, but I had to retire from that because of cancer. I'm thinking my terminal cancer could be from inhaling a lot of forest fire smoke and the stress of combating forest fire in my career, but I guess that's all water under the bridge now. I've been in the health system because of my situation for a long time, and although I'm thankful to be in Alberta, I'm seeing a rapid degradation of health care. It is really too bad that the UCP canceled the super lab because we desperately needed that super lab. Like I said, the wait times for getting blood work done can be excruciating. In my opinion, Alberta is not keeping up with the provision of additional infrastructure, equipment, and medical staff to accommodate the increase in the population to our province. Their hands are tied if they do not have the facilities and the staff to be able to do their job to make the diagnosis that's required and to make us well. The state of health care right now gives you a real sinking feeling in your heart. Thank you.
Well, thank you, Rob. Appreciate you joining us here today to share your story. I can't begin to imagine the stress you and your family are experiencing while you wait these 7 months to find out about this potential new cancer. Because frankly, Albertans deserve to be able to access the health care they need when they need it, and close to home. It's devastatingly clear that Danielle Smith and the UCP simply cannot end the chaos they are responsible for creating in our public health care system. But the Alberta NDP has made a commitment to each and every person in this province that we will work day and night until we do. Should we be fortunate enough to form government at the end of May, we will launch the largest health worker recruitment campaign this province has ever seen. We will get started on that from day one. We also know that primary care is the foundation of strong health care. We need to support and invest in primary care to fix our health care system. We recently announced our plan, developed over many months with the collaboration of healthcare workers, that is designed to modernize primary care by increasing team-based care in Alberta. Our family health team's plan will provide quicker access for patients, more comprehensive care through leveraging the strength and integrating the talents of different healthcare professionals. This plan will support 1 million more Albertans, like Rob, to be able to see a family doctor or another member of a team within a day or two close to home. It will take the strain off our urgent care centers. Situations like Rob's and so many other Albertans who have shared their stories and continue to share those stories are absolutely heartbreaking. Rob deserves better. The healthcare workers who are fighting on the front lines to provide the care Albertans need and deserve better. All Albertans deserve better. Thank you, and I'm happy to take any questions.
Thank you. Just a reminder, if you're on Zoom, it's the raise hand function to get in the question queue. If you're on the phone, it's *9. Seeing none, that concludes our press conference for today. Thank you.
Thank you.
Thanks for watching, and to learn more, check out albertasfuture.ca.